Hello everyone. Today we are going to discuss about OET writing. Okay. So in first 5 minutes you need to understand the writing task which in which you will understand what type of letter it is and whom you need to write it down. Okay. You need to understand the address and of course what type of letter it is, and after that you need to go to the rest of the details. So here the details are: patient name is Mr. Davish Woods. You cannot write in your first 5 minutes because this is the reading time only. In your finals also they will not allow you to write in your first 5 minutes. After the 5 minutes they will allow you to write, where you will get only 40 minutes to write it. Okay, so in your first 5 minutes you need to utilize those 5 minutes, and you need to understand your writing task, and you need to understand the important information regarding your letter. You need to choose, or you need to select the data, and you need to eliminate the irrelevant information. And what how you can do this? You need to understand whom you are writing. Okay, what important information they need and what type of information is important for them. So only you will choose that information, and rest of the information you will not write. Okay, so you will mark that cross and you will not write it in your final letter. So we need to understand the letter. Firstly we need to understand the writing task. Here it is: using the information in the case notes, write a transfer letter. So this is a transfer letter, okay, to Miss Smith Brown, who is head of nursing in rehabilitation center. So they have given the information that you need to write the letter to Miss Smith Brown. You are writing a transfer letter to Miss Smith Brown, who is head of nursing in rehabilitation center. In next line they have mentioned that you need to write a letter on this address. What address? To Miss Brown, head of nursing, Brisbane, QLD, Australia, 4001. Okay, so this is your writing task. We have understood it. This is a transfer letter, and whom we have to write it to Miss Brown, and the rest of the address is given. Okay, we will move to our rest of the information, and the patient name is Davish Woods. We will write it down, so it is important. Age we are going to mention, so it is important. Diagnosis is CABG. So CABG is a procedure or surgery, open heart surgery, so it cannot be diagnosis. Diagnosis is given in the past history. It is hypertension, high cholesterol, arthritis, and CAD. These are the diagnoses. Family history: married. He is married, carer for his wife who is registered blind. So it is important because he is the only one who is caring his wife also, and he himself underwent a surgery which is coronary artery bypass graft. Okay, so it is important to write the this first line. And daughter, married with children, lives overseas. Hobbies: you do not need to write these information. You need to eliminate the irrelevant information. This is important. This is not important how the surgery was performed, whether it is on pump or off pump. So you need to eliminate this part. Okay, so on 23, our today's date is 29. How you will get it? Today's date, whether it is the discharge date, whether it is a last visit date, whether it is your recent date. Okay, sometimes they mention admission date and discharge date, so your discharge date will be your today's date. Sometimes they mention it clearly here, today's date. Okay, so your 29 5/21 is your today's date. Okay, so where we were on 23 5/21. So on 23 May 2021 he was admitted to hospital and underwent surgery. Yes, it is a surgery. He underwent CABG on 24. So he was admitted on 23, and the surgery was done on 24. Graft was taken from left leg He was admitted in ICU for 24 hours after the surgery. Whole information is important here. Okay. Administered IV antibiotics, analgesics, and antithrombotic agents. Okay. Chest tube was in situ. Drainage was 20 ml. Vital signs were in normal range. Dressing was done in graft site, which is left leg. Provided he was provided with elastic stockings and elevated leg for 24 hours to reduce the swelling. But swelling is not given, so we will not write it down. But we have understood that why the elevator legs was for. Okay, so 23 was admission date, 24 was surgery date, and he was in ICU for 24 hours, and the whole things they have done in ICU was given in this para. Okay, next day on 25 he was transferred to ward. Chest tube was removed. His wound were in normal limits. WNL means within normal limits. If you do not know any abbreviation, please skip it. Okay. Complaints of pain over the chest and shoulder, administered Brufen. He has complaints of pain over the chest and shoulder, for which he was administered Brufen, or he was managed with Brufen. Daily physiotherapy was initiated or commenced, in which deep breathing exercises and walking 4 to 5 meters 4 times per day were initiated. Okay. Exercise data sheet provided. Okay. Again, the temperature, PR, pulse rate, respiratory rate, BP. You do not need to write it down in a sequence. You can write it. Vital signs were in normal limits. Okay. So, okay, after 25, the date is given 29. So, this is the last date. So, it is a 2 days date. After 4 days, he was ready for discharge or planned transfer to rehabilitation units for 3 weeks. It is very important. And his follow up was planned for on 7th June 2021. And here are the requested part. What we are requesting to Miss Brown is, we are requesting her to assess his wound over the chest and graft site. We are requesting her to dress over the wound twice weekly until suture removed. Suture should be removed after 2 weeks, and we are requesting her to continue his deep breathing exercises, which were walking and deep breathing, okay, techniques. And walking can be increased gradually. Okay, and also we are requesting encourage him to avoid heavy lifting, and we are requesting her for arrange carer and meals before discharge to home, because he has already underwent a surgery, and he is the only carer for his wife. So that's why we have requested her to arrange a carer and meals before discharge to home. So let's start the writing part. In this letter or video, we are going to write only two paragraphs, which is the first paragraph, purpose, and the second paragraph. In second paragraph, you can write the social and medical history, or also if you want, you can include your during hospitalization part. But I'm going to write a purpose paragraph first, and then the social and medical history. Okay, so let's start the writing part. Okay. So you need to write the address first. The address was to Miss Brown, or to avoid the time consumption, we can just mark it here. First, in first line, you will write the Miss Brown. In second line, you will write head of nursing, and in third line you will write the Brisbane QLD, and in fourth line you will write Australia 401, and you will leave a line after that, and after that you will write the latest date or today's date, which is 29 5 2021. You can write it at as it is, okay, if you want, or if you want in another pattern you can write it down as 29 May 2021. Okay, after today's date you will write, dear Miss Brown, dear Miss Brown. We will use the second name because we have already used the first name, which is Miss Smith Brown. Okay, the first should be Miss Smith Brown, not Miss Brown only. You need to write the full name. First is Miss Smith Brown, second is Head of Nursing, third is Brisbane QLD, and fourth line is Australia 400 or 001. Okay, after that you need to write your date, and after one line you will write, dear Miss Brown, and after that you will write, regarding. You need to drop a one line after each. Okay, regarding, regarding. You need to read the exact spelling, and you need to write the full name, Darvish Woods. Okay, I will write it down here so you can understand it easily. Regarding Darvish Woods, aged 77. Okay, put a comma here and you can continue the line by writing age 77, or the pattern they have given you can also write as it is. If they have given the date of birth, you can write the date of birth as it is they have mentioned, or you can write it down like this, or also age 77 years. Okay, so this is it. Now we will start our first paragraph, which is a purpose one. See, so we have already understood the letter, what it was. Okay, about, it was about transfer letter, and we are transferring him to rehabilitation center for what? For rehabilitative care and management. Okay, for 3 weeks. If you want you can write it down in your purpose para, especially for 3 weeks, or if you want to write it very simple you can keep it simple. Okay, so I'll tell you about 3 to 4 type of first paragraph how you can write in this letter. So today we are going to discuss only first and second para, and I'll tell you how you can write it down in a different way. Okay, so we will discuss the first paragraph. Here we have different techniques of writing first para and second para. You can take a screenshot and you can have a look, and you can select one pattern which you find very easy and you can practice that. And in my next video I will explain about during hospitalization and request part. And please do subscribe my channel for future videos, and thank you for being here. Thank you so much.